So I think we're going to get started now. Hopefully everyone can see Adam and I both clearly on the screen as well as the slides. But I just want to give a quick introduction because I know lots of you are new on this webinar, which is fantastic. And welcome all, and thanks for spending your evening with us. And we're very grateful that you've joined us. And I'm very excited for this webinar on an incredible topic, food and mood, with consultant psychiatrist, Dr. Adam Joyner. And we're so grateful to be able to run these webinars with the help of Oatly, ProVeg and the British Society of Lifestyle Medicine. My name is Rahini Bajekar and I'm a plant-based nutritionist and advisory board member with Plant-Based Health Professionals UK. We're a community interest group dedicated to the promotion of a whole foods plant-based diet. And anyone can join, you don't need to be a health professional. Our website is pbhp.uk. So we are running these webinars on a fortnightly basis. And we're featuring a range of experts, including doctors, dietitians, and nutritionists, and lots of different people who are offering their expertise very kindly to us. So I want to thank our sponsors, Oatly, which make fantastic fortified plant-based milks, ProVeg International, which is a fantastic organization helping people to lead plant-based lifestyles. And we are also CPD accredited with the British Society of Lifestyle Medicine. So everyone who attends this will also get a certificate. So this 1 hour webinar counts towards 1 CPD hour. Just admitting a couple more people here. We always get lots of people joining throughout. Just a reminder to keep yourselves muted and your videos off. So first, let me introduce Dr. Adam Joyner. He is a consultant psychiatrist and completed his training in the northeast of England. And he has a special interest in ADHD as well and does a lot of work with Psychiatry-UK. He obtained his medical degrees from Guy's, St Thomas and King's in London before moving up north. And he'll be sharing a bit more about his background, but also his entire biography is available in the speaker notes. So definitely go and check that out. It should have been on the registration page when you signed up. So we're going to kick off with Adam's presentation, and then this is going to be followed up with a Q&A. We already have had so many questions that were sent in advance, but if you've got any questions throughout this webinar, please jot them down in the Zoom chat, and you can also message me privately on the Zoom chat if you would prefer to remain anonymous. But you can also share other tips and help people if they've got questions that you can answer in the chat. So that will be ongoing throughout the webinar. I'm just admitting the last few people and then we're going to get started and I will hand over to Adam. At the end of the webinar, I will also be announcing our very exciting next guest for May the 27th. So definitely stay tuned for the entire webinar to find out who that is, as well as a bit more detail about Plant-Based Health Professionals UK. Great. So Adam, I'm just going to stop share, and if you could share your screen with everyone, then we can see your presentation.
Okay, see that okay?
Yes.
Great. Okay, thanks very much for that, Rahini. Hello everyone, and thanks for joining us. Yeah, so there's not a lot else I'll say. I'll just crack on with the presentation. So as you know, I'm discussing food and mood today. And the three things that we'll be looking at today is looking at some of the evidence for diet and the impact that has on our mental well-being, in particular preventing us from developing depressive symptoms. And then we'll look at some of the evidence for diet and food on essentially treating people who are suffering with a depressive disorder. And then we'll touch very briefly on some of the possible biological mechanisms that might explain how food impacts our mood. Okay, so I wanted to start with just introducing Mental Health Foundation, which is a charity whose aim is to help prevent people from ever developing mental illness or mental health conditions. And there's a good short article on diet and mental health, and the link's at the top of the slide, which is well worth reading if you're interested. But just to kind of introduce the first line of their article, it talks about eating a well-balanced diet rich in vegetables and nutrients. And of course, there's a picture there of lots of different veg. So that's sort of setting the scene for today. Then a little while ago, I saw this headline on the NHS website, which says, "Eating more fruit and veg improves mental well-being." And when I read into this, it was actually describing a study that had been recently published, "Let Us Be Happy, a longitudinal UK study on the relationship between fruit and vegetable consumption and well-being." And this is a study that's taken data from a UK household survey of around 50,000 people over 8 years. It was an epidemiological piece of research, and the conclusion that the authors draw from the data that they analysed is really that the consumption of fruit and vegetables actually has a dose-response relationship for our mental well-being. So essentially, the more fruit and vegetables you consume, the better you will feel, and the less likely you'll develop depressive symptoms. And they try and quantify that by looking at other metrics that impact psychological well-being. And for example, they say that if you eat 5 portions of fruit and veg less per day than you're doing, then that might be the same as, I'm sorry, I forget if it's either divorced or widowed. So it can have quite a big impact. And actually, there was a similar study done in Australia, published 4 years ago. This time it was looking at just over 12,000 people over 6 years. And their results, just from the abstract here, increased fruit and vegetable consumption was predictive of increased happiness, life satisfaction, and well-being. And actually, increasing by 8 portions a day gave you the equivalent psychological gain, i.e. improvement in mental well-being, as moving from unemployment to employment. And one of the other things that these authors concluded, which we'll touch on in other studies later, was that you actually gain quite rapidly psychological benefits from increasing your fruit and vegetable consumption much quicker than you would with physical health. The next study I wanted to highlight was this one. It's because it's it's a very robust study, very well designed. It's a systematic review and meta-analysis of observational studies, but particularly those that have used healthy dietary indices to predict risk of developing depression. And the results were that people who adhere most closely to Mediterranean-style diet are less likely to develop depressive symptoms. So those who were most adherent to that kind of diet were about 33% less likely to develop depressive symptoms than the people who were least likely to adhere to Mediterranean-style diet. And the second sort of best diet was a diet with a low inflammatory index, and people who could adhere to that kind of diet were around 24% less likely to develop depressive symptoms. So dietary indices are measures where people essentially get scored for different types of food that they've been eating. And for the Mediterranean diet, the one that's been most effective, the Mediterranean diet score and adjusted Mediterranean diet score include 9 items, 5 of which are considered beneficial. So that's fruits, vegetables, legumes, cereals, which I suppose means whole grains, and fish. So fish is in there as well. And the 2 that are considered detrimental to our health and psychological well-being is meat and dairy. So, so all of this is suggesting that fruit and veg and plant foods and fish as well is what we need to look after our health. But there is research that suggests the opposite as well. And in fact, there was a systematic review, but not a meta-analysis, that was published just last month. And the conclusion of this review was that meat eaters have better mental health than vegetarians and vegans, and that people who abstain from meat are more likely to experience depression and anxiety. Well, there's actually quite a lot of sort of errors really, and things that you could criticize about this study, and I'm not going to go into all of that today because of the time. And I know that I've seen on the plant-based health professionals Twitter and Instagram feed that Shireen has summarized quite nicely many of the problems with this study. But I'll briefly mention a few things. So first of all, it looked at quite a lot of different types of studies, so observational, cross-sectional, and RCTs as well, and tried to kind of amalgamate those results. So some of the cross-sectional and observational studies I was aware of, and so there's some quite old studies now that have found that vegetarians experience more incidents of depression and anxiety than non-vegetarians. But conversely, there's plenty of studies that show the opposite. And it's thought that the studies that suggest that vegetarians are more likely to have depression, that there's probably some other confounding variable or reverse causality there. And indeed, the authors of this study do actually give a nod to the limitation that they can't say that abstaining from meat is a cause of poor mental health and that consuming meat is a cause of good mental health. The other difficulty with the studies that they used is they don't use dietary indices, so they rely on people actually reporting whether or not they're vegetarian, which has its limitations, but also we don't know the quality of the diets, for example, that the vegetarians were consuming in the studies. And I was also surprised to read that apparently there was some funding either to some of the authors or for this study from an organisation that promotes beef consumption as well. So that was a concern as well, and makes you kind of wonder if there was some selection bias around the studies included. And indeed, there are some studies that I'm aware of that weren't included that probably, in my opinion, met the inclusion criteria. But anyway, we'll move on. So all of those studies that we've looked at now focus only on association, not causation. So we've talked about, so they show, there might be some kind of link between mood and diet, but cannot say for certain that changes in diet affect mood. So we need trials and randomized control trials in particular to establish that. And the first study that I want to talk about actually isn't a trial, it's a survey, but it's called Many Apples a Day Keep the Blues Away: Daily Experiences of Negative and Positive Affect and Food Consumption in Young Adults. So affect here means mood. And it recruited 281 people aged 18 to 21 and got them to fill in a questionnaire every day online for 3 weeks. And what they found was that consuming more fruit and veg led to improved mood. And in particular, that it was on the day that the people ate that fruit and veg and the day after that they experienced and described the improvements in their mood. And in particular, it was on days when they got really good mood was when they were eating 7 or 8 portions of fruit and veg a day. So this is a randomized controlled trial now. Let them eat fruit, the effect of fruit and vegetable consumption on psychological well-being in young adults. So in this study, 171 psychology students aged 18 to 25 were studied over 14 days. And to be recruited into this trial, they had to already be consuming 3 or less portions of fruit and veg a day. And the recruits were divided randomly into 3 different groups. A control group who were told to sort of do nothing other than to continue eating their usual diet. And in fact, of course, all of the participants were asked to just eat their usual diet. One group was sent text message reminders to eat additional fruit and veg, and they were given vouchers to go and get free fruit and vegetables from a shop. And then a third group was just given 2 portions of fruit and veg every day to eat. The group who were given the fruit and veg, they reported improvements in their energy, motivation, and also social measures, such as feeling connected to people. But they didn't describe any changes to mood or anxiety. So what does this study tell us? Well, it could be that people are too lazy to go and get additional fruit and veg, even with reminders and vouchers. It could be that psychology students already have really good mood and low anxiety, and so there wasn't going to be much improvement. Or maybe that just small increases in fruit and veg just start to have a positive impact on energy and motivation, but maybe we need to eat even more fruit and veg for it to start to impact on mood. So I suppose what a lot of people will be wondering is, does going vegan or switching to a plant-based diet improve your mood? And this RCT, this randomized controlled trial, attempted to answer that. It's an American trial done over 10 years ago now. And they went into an insurance company in America called Geico and recruited people there. And they had a control group where nothing happened, and the intervention group for, I think it was 22 weeks, where participants met weekly and learned about making vegetarian food and all that kind of thing, and classes and whatnot. And the results found that there was significant improvement in mental health in the vegan group. These aren't people with any mental health problems. So that's fine, but actually the control group didn't receive anything. So we don't really know if it was the meeting weekly and having classes and get-togethers and all that kind of thing that actually improved mood rather than the vegan diet. Also, the outcome measures weren't particularly robust. But the study was repeated by a different group in the same insurance company, and this time it was multi-centre randomised controlled trial, multi-ethnic population. 292 participants this time, and more robust outcome measures were used as well. And they found in the vegan group that depression significantly improved, anxiety, fatigue, and emotional well-being all significantly improved. But again, the control group received nothing, so we still don't really know if it's the actual getting together, having weekly input and support that is the intervention that works. So I would hope to see this study repeated with improved methods next time and improvement for the control group. Okay, so there are other studies out there that suggest that plant-based diets can improve psychological well-being. So systematic review of trials looking at the effects of plant-based diets on the well-being of people with type 2 diabetes found that there was improvement in mental well-being. And many people listening will be familiar with the broad study done in New Zealand, which looked at whether or not plant-based diets could help people with obesity or diabetes lose weight, and some secondary outcome measures from that study found that there was improvements in self-esteem for the group who consumed the whole food plant-based diet. So recently some dietary guidelines were published in Nutritional Neuroscience for the prevention of depression, taking into account the evidence base, and there was 5 guidelines or 5 recommendations that are made. So the first one is to follow a traditional dietary pattern such as Mediterranean, Norwegian, or Japanese diet. I'm not sure what the evidence is for Norwegian or Japanese diet in particular, but I think the authors are just suggesting that you try and avoid a Western diet, really. The next thing they recommend is to increase how much fruits and vegetables and legumes, whole grains, nuts and seeds you eat. They then recommend consuming foods rich in omega-3 polyunsaturated fatty acids, so that includes fish, or if you're vegetarian or vegan, ground flax seeds, walnuts, and I suppose algae. Replace unhealthy foods with wholesome, nutritious foods, and limit your intake of processed foods and fast foods and baked goods and sweets. So not anything too surprising there, really. Okay, so that's looking after our own mental health and mental well-being and trying to prevent us from developing depression. So what about if you already are suffering with depression or have a depressive disorder? Well, the place I thought I'd start at, given that we're with plant-based health professionals today, is a plant-based diet something that can be used to treat depression? And only one study has actually attempted to answer that question, and that's this one here by Null and Panesi. They recruited 500 patients and who had all been previously diagnosed with moderate or severe depressive episode, and they were currently suffering with that, by a doctor, and also one other, the plus one is one other chronic disorder such as arthritis or diabetes. The intervention in this trial was to eat a whole food plant-based diet, of which 70% was raw. And there were several other restrictions as well, such as no caffeine and no alcohol. Participants had to exercise every day. They had to undertake mindfulness or meditation every day. They had to make changes to their environment, like keeping things clean and tidy. And they had to do juicing as well, learn how to juice their fruit and veg and drink that. Unfortunately, despite recruiting so many people, they didn't bother with a control group, which was surprising and frustrating. And 2/3 of participants actually dropped out, and 85% of those who dropped out found the modifications were too rigorous. The next most cited reason was lack of time, and then the next most cited reason was family influences. So, for example, if you're trying to eat a plant-based diet and the people are eating hamburgers and pizza and things, then apparently that just was difficult for people to manage. So that's something to bear in mind if you're ever giving advice to people. Another problem with this study is the outcome measures was just these health diaries, and it's not really explained what they mean or what they are. But the results, the main results anyway, summarised here in this graph, show that of the 1/3 of people who could complete the trial, nearly 2/3 actually described a large improvement in their mental health and depressive symptoms, and only 7% described no change at all. And then they did some follow-up at 6 months for those 1/3 of people who could complete the trial. And over 3/4 were actually able to decrease or stop their antidepressant medications. So it's pretty impressive, but unfortunately the quality of this study is so poor that I don't think I could recommend that, yep, if you go on a whole food plant-based diet, you can treat your depression, unfortunately. So we need more studies, really. The best evidence we do have for diet for treating depression is the SMILES study. This recruited people with major depressive disorder who were consuming a poor diet, mostly processed food and processed meat, lots of things like pizza. They recruited 67 people, and there was roughly 33 in each group, 33 in the treatment group and 33 in the control group, and it was 12-week study period. So the diet treatment was a predominantly whole food plant-based diet, but it also included meat and dairy, and participants were encouraged to eat 1 or 2 portions of red meat a week, 3 or 4 portions of white meat a week, about 2 or 3 portions of oily fish a week, and some low-fat dairy as well. And the control group were given support. So like other dietary interventions, when people meet every week and have classes and lessons and support, the control group actually met together every week, and but they had sort of tea and biscuits and chats and general support. So we can be a bit more confident in this study about the actual effect of the diet. They also used a really robust outcome measure, the Montgomery-Åsberg Depression Rating Scale, which is sensitive to changes, particularly with interventions. It was a scale designed to be used in testing antidepressants in research trials. And as you'll see here, the diet group experienced a greater improvement in their mood score than the control group. And nearly 1/3 or 10 of the participants in the diet intervention actually went into remission, which meant they no longer suffered with depression. They didn't meet the diagnostic criteria. And two people in the control group experienced that, which was significant. But actually the effect size, Cohen's D here, was really impressive at over 1, and anything over 0.08 is really high, so 1.16 is very impressive. And the number needed to treat is 4.1, and if you're wondering what it is for antidepressants, it's between 5 and 7. So this is a really robust, well-designed study with really impressive results. Now, unfortunately, before they started recruiting, the power calculation was around 88, so they've under-recruited. I know they had difficulty recruiting into this trial, and so it can really only be seen as a pilot study or initial trial, and so it would be fantastic to repeat this study and similar studies, particularly multi-centre RCTs, and hopefully that will happen in the future. A more recently published RCT last year is the MMEd trial. The intervention in this study was a Mediterranean-style diet plus a fish oil supplement. The participants were people who had been diagnosed by a GP or were self-reported as suffering from depression, so people who believed they were suffering from a depressive disorder. So probably not the most reliable method of recruitment, but certainly pragmatic. They also use the DAS-21, Depression Anxiety Stress Scale, 21-item version, which is a scale used to just identify sort of psychological suffering, and isn't really as sensitive as the Montgomery-Åsberg in detecting changes over time due to interventions. There was also a high attrition rate as well, so 1/3 of people dropped out of the treatment group and just over half dropped out of the control group, although it was a slightly longer study than the SMILE study at 6 months. Well, both groups described, or there was improved scores on the DAS-21, although the improvement was more for the treatment group. More people experienced an improvement in the treatment group, and that was statistically significant. So unfortunately, this trial doesn't tell us a whole lot at the moment either, but what they did do actually, which was really good, was analyse the effects of the different food groups and the different foods that people were looking at, consuming. And they found that unexpectedly Mediterranean diets were statistically significantly more likely to lead to reduction in the DAS-21. But interestingly, nuts as well were statistically significantly more likely to lead to reduction as well. And the other one was the variety of vegetables that people were consuming. So the more variety they were consuming, the more likely their DAS-21 score would improve. There was a couple of things that weren't statistically significant, but were almost that, and there were some of the vegetables in there. And then sort of junk food and meat consumption had no impact on DAS-21 score. So this trial I wanted to include because it's so well designed. 1,000 people, 12 months of follow-up. It's not quite an intervention for people suffering with depression. It was looking at whether or not multi-nutrient supplements or behavioural therapy could prevent people with obesity who also had mild depressive episodes from developing moderate or severe depressive episodes. And quite simply, no, supplements or behavioural activation actually couldn't prevent that compared to controls. So multi-nutrient supplements probably aren't a viable treatment. While we're on the subject of supplements, many people will probably be wondering about fish oils and omega-3 supplements. The American Psychiatric Association actually recommends fish oils or omega-3 supplements for the treatment of depression. This is a very recent review, 2019, which I'd highly recommend reading if you're interested in this in particular, which reviews the evidence base for the American Psychiatric Association's advice, and really concludes that it's just not there. That at best the evidence is inconclusive, and that really the studies that have found that there is a benefit to people with depression on taking these supplements those studies are worse quality, usually smaller as well, and the better conducted studies find that there's no difference to placebo or to the control group. And in fact, the authors of this review point out that not only is the available evidence suggesting that it probably wouldn't help, but if anything, you could be doing some harm, and they cite some potential increased risks to cardiovascular health from taking these supplements. And I think I've heard Neil Barnard speak recently about maybe an increased risk of prostate cancer as well for people consuming omega-3 supplements. So I wouldn't recommend them at the moment. Okay, so we'll be finishing now on looking at some of the possible biological mechanisms which may explain how food impacts our mood, but this certainly isn't proven, it's not empirically demonstrated, and it is theoretical at the moment. There's kind of four major proposed biological mechanisms which probably all overlap. One's inflammation, the other is oxidative stress, another is brain plasticity, and another is the microbiota and the gut-brain axis. So most psychiatrists will be aware that there's an increasing evidence base that many mental health conditions have have inflammation as part of their etiology, some low-grade inflammation. And there's, for example, there's been studies looking at whether or not anti-inflammatories and antibiotics can actually help to treat schizophrenia based on those kind of models. And there's many different aspects of our environment that can impact inflammation in the body and the brain, so not just diet, but our weight, how much sleep we're getting, stress and smoking, for example. And there's quite a strong evidence base that whole plant foods produce inflammation, and so that might be one mechanism as to how all these fruits and vegetables are helping us. There's a systematic review here which reveals that people with depression compared to healthy controls without depression have lower antioxidant levels and antioxidant capacity, and so we know that fruit and veg have lots of antioxidants in them. Brain plasticity, so this is about neurogenesis or the formation of new neurons, and also formation of synapses, which is the connections between neurons and kind of changes to the synapses as well. And all of that is important in all the functioning within our brain. So of course, regulating mood, we need to be able to our brain needs to be plastic in order to regulate our mood as it needs to do for anything like learning, thinking, planning and remembering and everything else. So the two major components of brain plasticity is, well, two parts, the part of the brain called the hippocampus, which we have two, one on the left, one on the right, and they're both close to the center of the brain. And the biochemicals in the brain called neurotrophins. So these are the major players in brain plasticity. And the most commonly known neurotrophin is BDNF, or brain-derived neurotrophic factor. So one study showed that Western diet is associated with a smaller left hippocampus, not right hippocampus, that remained the same size. And but the smaller left hippocampus was particularly true in older people. And polyphenols, vitamin E, omega-3 fatty acids stimulate neurogenesis, and those are all things that can be found in plant foods as well as fish. And diets that are high in fat and sugar impair neurogenesis. So then thinking about the gut-brain axis and the bacteria that live in our bowels, they've been implicated in the modulation of BDNF as well as serotonin, which is a neurotransmitter important in regulating our emotions, and the hypothalamic pituitary adrenal axis as well, and the stress response to that axis. One study which compared to healthy mice and microbiota deficient mice found that compared to the healthy mice, these deficient mice had reduced BDNF and serotonin. So 5-HT is 5-hydroxytryptamine, which is just another word for serotonin. And these same mice also displayed an increased stress response. In humans, there's actually a difference between the microbiota in the guts of depressed patients versus healthy controls. And there's one study that found that when you take the feces of the patients who suffer with depression and transplant it into healthy rats, the rats actually start to exhibit depressive behaviours. So I think there's going to be quite a lot of research done in this in the future, because I think that's quite a fascinating finding, really. Then increased interstitial permeability is a risk factor for depression as well. And this essentially means leaky gut, so your bowel allowing more things through into your bloodstream than it otherwise would. And diets high in fat can increase interstitial permeability. So that's where we're going to end, but just wanted to highlight 2 further readings if you're interested. So if you want something fairly academic, I recommend this paper around nutritional psychiatry, the present state of the evidence. It is a couple of years old now, but does summarise very nicely all the available evidence for not just diet on mood, but diet on all aspects of mental health. And if you want something less academic, but a bit longer, I recommend this book, Brain Changer by Felice Jacka. It's a really good book. And for the observant among you, you may have noticed that Felice Jacka's name appeared as an author in many of the articles I've described or discussed today. And in particular, she's an author of the better conducted and more robust studies I've talked about. So that's it from me. So back over to you, Rahini.
Yes, hi. Yeah, you think you'd stop this screen share now.
Oh, do you want me to go back to it?
No, that's perfect. Thank you so much for that, for the presentation. It was fascinating, and I think we all learnt a lot. It's a huge topic, but you definitely covered sort of, yeah, all the key studies that we all reference regularly. So we had quite a lot of active discussion in the chat, and I'll come back to that. But I think we'll go straight into the Q&A because we had a lot of questions, and we'll try and get through what we can. But one of the ones that came up most recently, which I thought was quite, was quite funny, was about teenagers, and it was someone asking about how can we help teenagers to eat a more plant-based diet when they're struggling with depression and anxiety. So I was wondering what your thoughts were on that. I think it's something that a lot of people on this call would relate to as a struggle.
Yeah, so great question. So, and certainly in my clinical work, I work with teenagers, 18, 19-year-olds and people in their early 20s with adult ADHD, and also my early intervention psychosis work as well. And yeah, they are a group who don't tend to want to listen to that advice. And I'm struggling as well to work that out. So I'm afraid I don't have the answer, but if anyone else does, I'd like to know.
And yes, I think that we're going to have a few more webinars on some of these topics, including ones with registered dietitians as well, who might be able to provide some advice on how to transition your family to eating a more plant-based diet and eating a more plant-predominant diet. So hopefully some of the future webinars can also touch on this, because I think it's something that would be relevant for a lot of people. One of the other questions that I received was, do you have any tips for maintaining a healthy weight for people on medications such as pregabalin, SSRIs and olanzapine that are often associated with weight gain? And I know that this is a personal interest of yours, and this is one of the reasons that you got interested in diet and nutrition as well.
Yeah, exactly. So, well, first of all, there isn't any research that looks at sort of plant-based diets for improving or reducing weight gain from psychotropic medication. The evidence base really isn't very strong. Really, it only says that you're more likely to be able to lose weight when you've gained it from these medication if the intervention is by a dietitian, and if the intervention is done at the earliest point as well. So, unsurprisingly, first of all, it says, preventing weight gain in the first place is easier than losing weight. but then losing weight at the earliest point. That's it. That's kind of all the evidence base says. There isn't any consistent picture on what the method would be. We've actually submitted, me and some colleagues recently, a funding application for a piece of research looking specifically at whether or not plant-based diets can be used to help people taking olanzapine lose weight. But obviously we're not there yet. Anecdotally, I know one or two, I know a few people, a few patients who have managed to lose some weight, weight they've gained from psychotropic medication, from following predominantly plant-based diet, but that's just some anecdotal cases. Okay, great. So I think that hopefully we can do another webinar once you've had that research it's been accepted and that's underway. Hopefully we can do another one early next year. So going back to omega-3 oils, I think that this is definitely a hot topic within a lot of people who are plant-based. And the question was, with omega-3 oils, specifically EPA, and for those of you who don't know, that's eicosapentaenoic acid, have in the past been recommended for those who suffer from mental illness. Does this recommendation still stand? And where would a vegan obtain the amounts of omega-3 that are recommended, given that algae-based omega-3 supplements tend to contain more DHA than EPA? Is there a case for people with mental disorders to eat oily fish, krill oil, or other fish oil supplements? Sure. So, well, really, the evidence then is no, actually, at the moment. So, yeah, like I said earlier, the American Psychiatric Association recommend sort of fish oil supplement for people with depression, not other mental health conditions. The evidence base isn't there for other mental health conditions. The idea of eating fish for mental health doesn't actually come from trials or randomized controlled trials. It comes from epidemiological data that on the whole, people who eat more fish, or populations that eat more fish, coastal populations tend to, in some countries, not the UK, tend to have less sort of depression and maybe some other mental health conditions. But that doesn't mean it's the fish that's the cause of those improved mental health. And even if it was, it may only prevent people from developing mental health conditions, not help them recover from them. So my advice would be really, if get your DHA and EPA in the same way that anyone does. And if you're vegan, that's probably from ground flax seeds and walnuts. And if you're not, well, it can still be from that. But I guess if you're not vegan, then it can be from oily fish if you want. Yeah, that's really helpful. Someone asked about chia seeds and hemp seeds. So for chia seeds, you've got to make sure they're ground as well to absorb the omega-3 fatty acids, that alpha-linoleic acid that's present. So a lot of people don't know that about chia seeds. They do need to be ground the same way that you would grind flaxseed or linseed. And when it comes to hemp hearts or hemp seeds, you need to have slightly more. So it's about 1/4 cup of hemp seeds would give you your daily requirement. So yeah, just 2 tablespoons of ground flaxseed is generally what we recommend. But there's more information on plant-based health professionals' website as well if you're interested in that. So one of the questions that I thought was really interesting, and it came up in the chat as well, was about premenstrual tension. And specifically, this was from a lady who'd like to remain anonymous, who has premenstrual dysphoric disorder and possibly mild underlying depression that is exacerbated by the PMDD. However, she's always avoided the medication route as her symptoms have been quite mild compared to some experiences. She's heard that plant-based diet is helpful, and have you heard of this before? And do you have any non-medication related tips to try? Yeah, this is a common phenomenon that I've met in clinical practice. I mean, it's fairly specific, and actually, the evidence base for using diet in helping treat any mental health condition is very poor, and I've kind of presented what I feel is the best of it today. So there isn't any kind of research that's going to offer any specific advice to this person. Yeah, well, I can't think of any non-medication advice actually for this this particular difficulty that she's struggling with. No, sorry.
Yeah, I think that there's a lot of different advice relating to sort of more lifestyle tips out there, and I think some people in the comments have mentioned there's Dr. Hannah Short, Dr. Neetu Bajekar, lots of other gynecologists who might have tips as well. So do check out some of their work. I've got a question about the toxicity in fish. Is there a correlation between depression and eating the mercury in fish or other heavy metals in fish? Is there any evidence for that, Adam?
Well, not that I'm aware of, but it's certainly conceivable, isn't it, that, you know, heavy metals get into our brain and affect our emotion regulation. I suppose we'd have to eat a lot of fish for it to start impacting on our mood in such a way, particularly when really the evidence so far is that people who consume more fish are less likely to develop depression. So I think at the moment, in terms of your mood, the evidence is probably that it doesn't affect your mood, but of course, pollutants and heavy metals in fish may indeed affect many other parts of your health adversely.
Great, there's lots of active discussion in the comments, and some books that have been mentioned as well, and a good link from Dr. Hannah Short there and from Gemma as well, on some more information on PCOS and use of turmeric, use of ginger. So hopefully everyone's following the chat and can make some notes on that as well, because there's a lot of health professionals who've joined today's webinar as well. And one of the questions that I think we'll all relate to is about the quality of food in hospitals generally being poor. And can you recommend any strategy to maintain a healthy diet when you're in a hospital setting, particularly in an intensive care psychiatric ward, where limited food choices are offered from the food trolley? And should people who are eating a whole foods plant-based diet say that they're a vegan, and will this be respected in the hospital any more than any other kind of hospital menu or hospital department? Are there any tips or first-hand experience that you could share about?
Yeah. So I mean, this is actually incredibly sort of difficult area actually. So it will depend from trust to trust and hospital to hospital. You know, how you get on with that. Oh, sorry, closing the poll down that popped up on my screen. Yeah, so some hospitals and some trusts will be better than others, but there does have to be an element of risk assessment and risk management within all psychiatric wards, but particularly intensive care units. The experience I have actually is working with the public health consultant and her registrars in our trust in trying to make improvements in our own inpatient wards. And it's incredibly difficult to do because there are several barriers. You know, there's the procurement and the contracts with the caterers and various other things. And there's the way that the food is selected or not for people either who've been on the ward for a while or just arrived. And we one of our foundation doctors actually wanted to do a little project to see how easy it was to be vegan, and managed to convince in the end just one patient. He tried to do 3 patients to try go vegan for a couple of weeks to see if it would have any impact on their mental or physical health while an inpatient. But actually this patient had to stop after a few days because they said that in order to be vegan on the inpatient ward, all they could eat was potatoes. Now, I think it was a slight exaggeration, but it also highlights a common difficulty that people have. So we've been trying to make the change ourselves, and it's incredibly hard. So really the best advice is to patients is just to say that you're vegan if that's what you want. If you want to try and get a whole food plant-based on a psychiatric inpatient ward, whether it's intensive care or not, just say early on that you're vegan, and I'm afraid that's the best you're going to get at the moment.
Thanks, Adam. And I hope you don't mind. I'm just going to relaunch the poll there. It will pop up on your screen, but I would appreciate any feedback. And if you have any specific feedback about how we can make these webinars more helpful, please email us at plantbasedhealthprofessionals@gmail.com. So one of the questions that you did touch on the study in your presentation, but I'll circle back to it because it came up once or twice, and which was with regards to a plant-based diet and depression and anxiety in female teenagers and young women. Could you kind of touch again on the results of Felice Jacker's work? She wrote the Brain Changer book and conducted the SMILES trial, which I know you had in your presentation, but she suggests that plant-based diets can actually aggravate symptoms and recommends a little meat, possibly red meat, once a month or so. What are your views on this?
Yeah, well, I wondered about saying whether or not there were some things that I disagreed with in her book, and that was one of the things. So I think that she probably comes to that conclusion from two angles, although I can't be certain. But I think what it was first of all, there is that epidemiological data which was predominant, I suppose, at the time that she must have been writing that book and doing the SMILES trial and all the other studies that she's done, which was that vegetarians have poorer mental health outcomes than meat eaters. Like I said, there's been lots of work done since that would suggest that might not be the case, and that reverse causality was at least partially explaining that. So it might be that she has put too much emphasis on some data which isn't necessarily reliable. And then secondly, I suppose some young women might be prone to anemia, and it is of course really important to make sure that young women are getting adequate iron intake, because if you're anemic, then your mood can go very low. You can feel very tired. It can look like depression, low mood, I suppose red meat is a source of iron, a good source of iron, or a source of iron. And so I wonder if that's where she was coming from with that.
Yeah, I think that definitely answers that one. And there was just one more question that's quite general, but it's one that comes up very often, which was about the relationship between vitamin D and mood. Yeah, if you could just quickly touch on that. I know a lot of us aren't really getting the amount of sunlight we should be right now as well with lockdown. I know we're allowed to go outside more, but it'd be good to know what your thoughts are on this.
Yeah, so I think that actually this kind of brings on to a nice point, actually, that mood, what affects mood is multifactorial. There's many different things in our lives that affect our mood, from genetics to who we're living with, and jobs and diet and sleep and all the rest of it. And vitamin D is one part of that. So although vitamin D is important, I don't think it's probably not the most important aspect to ensuring our good mood. But certainly if we're vitamin D deficient, and then we want to be correcting that to increase slightly the chances of us not becoming depressed. And if we're already depressed and have low vitamin D, then we certainly want to correct that to add to the chances of us recovering. Yeah.
Great. We have got a couple more questions, but unfortunately we don't have time to answer those now. And a few of them are quite specific, and we wouldn't be able to answer those. But if you want to write to us, then you can, or you want to get in touch with Adam, then please do. That would be great. And thank you so much again, Adam. That was an absolutely fascinating discussion and presentation, and thank you for contributing to this webinar. I just want to quickly mention a little bit about Plant-Based Health Professionals UK. We have Dr. Shireen Kassam, who founded Plant-Based Health Professionals UK, also set up the UK's first plant-based university course at Winchester University, contributed to by lots of incredible plant-based experts in their field, covering everything from gut health to women's health to bone health. It's honestly fascinating, and there are still spaces available. So definitely go and find out more by checking out our website, pbhp.uk. And I just want to share our very exciting next guest for the 27th of May. So the link will be up on our website tomorrow, and it's with Dr. Caldwell Esselstyn, who doesn't really need an introduction, but this is so relevant for anyone who's interested in the topic of heart disease. His 20-year nutritional study is sort of laid the foundation for so much of the current kind of work and thought around the plant-based movement. And he really shows how what we eat really can impact whether or not, you know, we develop these chronic lifestyle conditions, and particularly his focus as a cardiologist is on heart disease. So, and that's going to be an amazing discussion. It's a 1-hour presentation followed by half an hour patient story by Dr. Arvind Meheru, who is a plant-based health professionals UK member and has spoken at many of our events before. So that's going to be a great one not to miss. And then we're going to have an exclusive Q&A as well with Dr. Caldwell Assistant. So it's a 2-hour whammy. It's a long webinar, so definitely get comfortable for that one. We'll be charging a nominal fee for people who aren't plant-based health professionals members so that we can continue to run these webinars. But of course, we'd be very grateful if you could donate whatever you feel comfortable with, and if you enjoy these webinars and you would like them to keep running. If you have any ideas for future topics or things you'd like to see, then definitely let us know. And a big thank you again to our sponsors for helping us to run these webinars, and to our amazing speaker, Dr. Adam Joyner. And this is a little bit more information about us. Definitely check us out on social media and put out lots of information out there. There are lots of questions in the chat, which we already have fact sheets on our website, ranging from everything to do with pregnancy to raising vegan children and so on. So you can check that all out at our website, and definitely join our community and be part of an incredibly vibrant community with lots of information, knowledge sharing. So hopefully see you at the next webinar. Thanks everyone.